So today we're talking to Dr. Thomas Lewis. Dr. Lewis is a medical researcher and scientist. He is founder of Health Revival Partners, and he's also a principal with us here at Good Medicine Choice Network. Dr. Lewis and his team put together a diagnostic protocol called 4 Dimensions of Health, which they utilize to measure risks and other determinants of chronic disease. And they've also recently published a paper on cytokine storms as it relates to COVID-19 and these risk factors. So good afternoon, Dr. Lewis. How are you?
Hi, Karen. I'm well today. How are you doing?
Good. So we wanted to talk a bit today about the research that you've done related to health risk assessments and cytokine storms. In particular, how those assessments are being used to classify the need for different levels of care for people with COVID-19. Thought you could tell me a bit about that paper and what your findings are.
You know, the foundation of that paper is that people who die from COVID-19 or have very severe symptoms have what's called a cytokine storm. And a cytokine storm is nothing more than your immune system in a last-ditch effort trying to keep you alive. So what these cytokine storm markers are being used for is to risk stratify COVID-19 patients in hospitals. So, for example, Harvard Medical School teaching hospitals are using these markers. But in our opinion, our paper is all about we should be measuring where you are in a continuum. I mean, there are some people that have no symptoms from COVID-19, and there are some people that die, okay? That establishes a continuum. And what your cytokine status is kind of determines how resilient you are or how vulnerable you are to dying from the disease. So, you can get tested with PCR antibodies. They're fine for letting people know if you've had it and how contagious you might be, but it does nothing to help you figure out how to survive COVID-19 or, for that matter, any other pandemic coming down the line or even from cardiovascular disease. So we believe our test is superior to a lot of these other tests that are going on.
They've said a lot that people with chronic conditions are more likely to die from this disease, certainly to have the highest risk of being on ventilation, etc. What is the difference between chronic conditions and these physiological markers that you're speaking about?
That's a great question. You hear a diagnosis of cardiovascular disease. And cardiovascular disease, people with that have the highest mortality from COVID-19, 1,200% higher than people who are healthy. But I can tell you today, there'll be a 50-year-old who's going to die of cardiovascular disease. And there's also a 50-year-old who's going to live to 90. The difference is measuring their physiological health and risk factors they have in their life that will perpetuate poor physiological health. So this is what we should be measuring, not PCR, not antibodies. From a personal perspective, am I going to get severe symptoms or am I going to die? And your resilience, how full your bucket is towards susceptibility to these diseases is most paramount. But it just shows you the connectivity between something like COVID-19 and cardiovascular disease. If you're really bad on the cardiovascular spectrum, you're going to die from COVID-19. That just shows you that the risk factors and the determinants underlying these two conditions have to overlap. And it's all based on your immune or physiological health. It's that simple. So the more you can improve that, the more resilient you're going to be towards this virus, other viruses, infection, diseases that we classify. So cardiovascular disease, that's a human-made term. It's really the underlying physiology that determines whether your heart's going to stop or your blood vessel's going to burst, for example.
What is the relationship or what is the process of a cytokine storm and how is it related to inflammation?
Yeah, it's so simple. We call inflammation a bad thing. You bang your toe and you're in pain and you're inflamed, but it's the inflammation that's helping restore that damaged tissue. So a cytokine storm is just simply a measure of inflammation, and inflammation is a measure of how much your immune system is working for you. We have an innate and adaptive immune system. Innate is immediate response. Adaptive, when you have a cold, it takes the immune system a little while to build antibodies against that pathogen, that insult. So no matter where you are, even in a cytokine storm, inflammation and your immune system is a treasure. It's just that you were overwhelmed by something your immune system didn't have the capability of handling. But it's all about bandwidth. People that already are fighting disease, and that's why Harvard Medical School tests what are called viral serologies to see what your baseline viral burden is, never mind COVID-19 or the SARS-CoV-2, because they know if your burden is already up here and this virus comes in, it's going to push you over the top, whereas someone who has a very low burden is probably going to do very well against the disease.
Do you think that you'd mentioned that there's a difference between the way that patients are being risk stratified, meaning how they're being looked at by the healthcare system to see what their need base might be related to being in critical care, related to needing ventilation, etc. How is that different from what you've seen in past, viruses or diseases, and how that the healthcare system is classifying those patients?
Well, I think it's important to note that when this virus struck in China, the doctors in Wuhan ran a very robust panel of labs, and some of them were highly elevated, and that's how they figured out what's going on physiologically. And Harvard Medical School and any number of hospitals that are doing triage on patients are now using that panel to try to risk stratify and characterize the risk of these patients, determine who's going to die and who could potentially survive. Very important in hospital. But in America, we for so long have done a very narrow set of biomarkers when you go in for your basic physical, your annual exam. We're fixated on the lipids. We do the A1C and a little chemistry panel looking at liver and kidney function. But what this is showing us is two very important things. The labs we're doing in America to routinely to measure someone's health are not adequate. And number two, that COVID-19 labs are overlapping into diabetes, cancer, cardiovascular disease, and an array of other diseases, because these are the people who are dying, the ones with these pre-existing conditions. So therefore, their bucket is already partially full with this inflammation that's being measured, which we're not, unfortunately, routinely measuring. Homocysteine, for example, very few docs are measuring homocysteine, C-reactive protein, fibrinogen, a clotting factor. We're very few patients out in America are being measured for fibrinogen. It's not an expensive test, but it's extremely important.
And are you hopeful that this might be an impetus to continue in traditional medicine to work along this path as opposed to falling back into high cholesterol, low cholesterol,
One can only hope, but, the coding system, the insurance, doctors don't really control medicine anymore. They have to play by the code book. So, that's why practitioners like myself and Dr. Arteminoff offer to people a much broader array of testing at very low cost, by the way, but it is a cash basis because the insurance companies just aren't covering, particularly in prevention or just risk screening. The tests that Harvard Medical School are doing to risk stratify COVID-19 patients, you walking into a clinic anywhere in the country cannot get covered by insurance, ever. Just not going to happen, sadly.
Had you read that men are more likely to die? I understand it's like they're twice as likely to die from COVID-19.
Well, in general, man, woman, child, physiological health makes a difference. Mm-hmm. Men on average live 6 or 7 years shorter lifespan compared to women. And that just says that, as men age faster for whatever reason. So that means their physiological health, probably along their entire lifetime, is not as good as that of women. It could be hormonal differences or, any number of factors, stress. We have similar but different paths. So I'm sure there are some commonalities that are tied back, but it's measurable. That's the end of the day. Measuring physiological health should not be a mystery.
What is your advice to somebody who's concerned about their immune health, concerned about how they can hold up to conditions such as this or other diseases that are oriented? Yeah, it's very straightforward, because if you go to the American Cancer Society, diabetes, heart disease, Alzheimer's, they're all talking about the same risk factors. So that just shows you, even the societies agree, even though they're separate, that they understand that basic health is basic health, and it's nutrition. I hate to say it, it's something as sublime and simple as nutrition, but it is. But we have to look at nutrition two ways. Calories in one bucket and repair and recovery from nutrients in the other bucket. And I would argue that the
Repair and recovery through nutrients is more important than the calories. Yeah, we need calories, but we store fat. We can survive for quite a while without that, but we need to repair and recover all the time. So if you're eating fast food, packaged food, going out to box store restaurants, these are businesses, you're not getting high nutrient density. So there's two ways to go. You can either really, up your game when it comes to the foods you're eating, or you can supplement. And what does a supplement mean? It's supplementing not calories, it's supplementing nutrients. It's upping your nutrient density. So in theory, and it's well proven now, that it's really improving the ability of your body to repair and recover. And when you repair and recover, if you can outstrip wear and tear, deterioration, and aging, then you can live a long, healthy life into your 70s, 80s, 90s. My mother, way into her 90s. My great-grandmother lived to be 94, so, and healthy all the way through to the end. So that's what we're trying to achieve with good nutrition, supplementing strategically to boost repair and recovery.
All right. Well, thank you very much for your time today.
My pleasure. Anytime. Thanks, Karen.